Hello everyone, my name is Madeline Podmore, and throughout this presentation I will be presenting a review of the literature on the effects of transcranial direct current stimulation on schizophrenia. Psychological disorders represent a large portion of public health issues. In fact, they account for 7.4% of the worldwide burden of disease and impact a variety of areas, such as personal well-being, social well-being, and quality of life. These impacts are particularly prevalent for individuals with schizophrenia, a chronic mental disorder that occurs in 1.5% of the population that involves a range of cognitive, behavioural, and emotional components. Gabriella Tortella divides the clinical symptomology into three categories: positive, negative, and cognitive. The positive symptoms are categorized by delusions, hallucinations, and thought and movement disorders. Negative symptoms encompass social withdrawal, lethargy, and blunted affect. Furthermore, Maureen Mondino outlines some of the cognitive aspects that are impaired as a result of schizophrenia, including language processing, learning and memory capacities, and visuospatial abilities. Neuroimaging studies have supported the notion that these symptoms might be connected to abnormal brain activities with large dysfunctional brain networks. For instance, auditory verbal hallucinations have been linked to front temporal abnormalities and negative symptoms to hypoactivity in the prefrontal cortex. Transcranial direct current stimulation is a non-invasive form of stimulation using low-intensity direct currents to the brain via scalp electrodes. The current enters through the anode, moves through the brain tissues, and exits via the cathode, thus inducing bidirectional polarity-dependent changes in cortical excitability. Specifically, the anode creates an increase in cortical excitability while the cathode reduces it. The exact mechanisms in this process remain unknown. However, studies have emphasized alterations in resting neuronal membrane potential and synaptic modifications connected to NMDA receptor-dependent and GABAergic activity. TDCS can be a treatment for a variety of psychological issues and has a multitude of benefits. In particular, it is a cost-effective method and is easy to administer with very few observed side effects. Moreover, the use of this method may be significant for patients with side effects to medication or treatment-resistant symptoms. In particular, 30% of schizophrenia patients present with symptoms despite pharmacological treatment. Thus, TDCS has been researched as an alternative to treating this illness. In particular, studies have looked at the method as a treatment to auditory verbal hallucinations. Although the neurobiological basis of AVH is unclear, neuroimaging has identified that during their occurrence, there is an overaction in brain areas, including left temporoparietal areas and left inferior frontal areas, suggesting abnormal activations within speech perception and production. Studies have suggested this may be due to disconnectivity between temporoparietal areas and brain areas involved in the production and monitoring of speech. Therefore, TDCS has been introduced to combat this with the hypothesis that placing the anode over the left dorsolateral prefrontal cortex and the cathode on the left temporoparietal junction would modulate the abnormal activity of the respective brain areas. Studies including Maureen Mondino and Jerome Brunelin both have found significant reductions in the severity of these events relative to their sham group, which seems to be maintained for up to 3 months. Furthermore, both studies have also found reductions in negative symptoms according to the total positive and negative syndrome scale, thus indicating an association between these symptoms and left dorsolateral prefrontal hypoactivity. Furthermore, Verkerman reported that active TDCS facilitated probabilistic association learning in those with schizophrenia in the active situation compared to those in the sham group, thus illustrating an improvement in cognitive symptoms. These results demonstrate the effectiveness of this method in alleviating the symptoms associated with schizophrenia. However, the relatively recent usage of this technique on mental disorders, including schizophrenia, means that future research is required to further develop the method so it can be more widely administered. Firstly, the studies need to be expanded to include increased sample sizes who undergo additional evaluations, including quality of life, social autonomy, and further imaging. These studies should also incorporate testing various TDCS parameters to ensure best practice. Furthermore, long-term studies are required to establish the safety of this method on schizophrenic patients over time, thus further confirming the encouraging results found throughout initial studies and ensuring this treatment is made available to all patients.